Hi, I'm Dr. Allison Cole, sleep medicine specialist and bona fide chronic insomniac. Welcome to the Sleep is My Waking Passion podcast. Remember, knowledge is empowerment, and if applied correctly, it can help you biohack your way to a better night of sleep, just like I did.
Well, hello everyone, and welcome to yet another episode of the Sleep is My Waking Passion podcast. I am fangirling hard. I cannot even believe it, but Emma Cooksey is here. She's in the house. She's got to be, like, seriously, one of the most famous advocates for obstructive sleep apnea over the years in the sleep community. She is a writer. She is a speaker. She is a huge patient advocate. And she mentioned that she was diagnosed with obstructive sleep apnea, so her upper airway closes off at the age of 30. We're going to get into that story because it sounds like it was a really long and arduous process to get diagnosed. And part of the reason we're going to talk about it is see if we can start to narrow that window for other people, especially women, because we're largely, ignored basically. So she had a lot of unexplained health issues that she's going to get into, and they sort of all came back to obstructive sleep apnea. So this is really cool. She is a seasoned podcaster. She had the Sleep Apnea Story since 2020. She literally had 143 episodes. God bless you. You have been at it. And so she's finally retiring that hat. But that's not to say that those stories, that's the great thing about podcasting, right? It's available in perpetuity. So you're always going to have the ability to go back and listen to her podcast. But she has moved on to some even bigger and bolder things. So another thing that she did in 2023 was that she released the 6-week CPAP Solutions Workbook. And this thing basically is really to help new and struggling users of CPAP. I highly recommend that you check it out. Now, 2024 brings us to an absolutely new sort of era. Emma has been on the circuit, like I've seen her at Sleep 2024. That's when I first got to meet you in person, but I've heard about you over the years. She's done the Philadelphia Sleep Conference. She's done the North American Dental Sleep Medicine Symposium. And now she's actually joining. There's a patient advocacy organization that anybody who's struggling with sleep problems, I think you would agree, because it's so all-encompassing, should go to Project Sleep. And you're essentially now the Sleep Apnea Program Manager. Mm-hmm. So you are basically in charge of the sleep apnea education and awareness program. You gave me a lot of wonderful talking points, but I want to turn it over to you. Can you tell everybody, what you're doing with Project Sleep, anything else you want them to know about your journey as we get started?
Sure thing. So I think it's fair to say that I just got my dream job after working in this kind of patient advocacy sleep apnea space for pretty much 4 years since I started my podcast. I'd been on the board at Project Sleep and I could see all this wonderful work they were doing. And part of me just always thought, wouldn't it be wonderful to have some sleep apnea programming similar to some of the great stuff they've done for narcolepsy? And so we managed to get it funded and make it work. And I started working with Project Sleep the beginning of July. So it's only been a month, but there's been a lot happening. So we've already launched, my first program is Sleep Apnea Squad. So that's
it's all over social, guys. It's
all over everywhere. And so that is really about educating people all about sleep apnea. I think a lot of the problems that I see are around this hurdle. Our first topic is going to be, could I have sleep apnea? Which sounds so basic, but I think a lot of the really big hurdles with this diagnosis are people just not being aware of what the symptoms of sleep apnea are. And also this thing that you probably talked about a bunch on here about GPs and primary care physicians not really getting training in sleep. So the combination of those two things mean people like myself go a really long time to diagnosis. So we're trying to tackle that just by getting really good information out to people. And one of the things I love about the way that Project Sleep have done, so it's actually based on another program called Narcolepsy Nerd Alert, which people can check out. I love that name. So they really try and meet people where they are, which is what I love. Like, there's only so many people that I could reach with a podcast, because some people don't really engage with podcasts, right?
Right.
So with Sleep Apnea Squad, we're starting with live broadcasts on Project Sleep's YouTube channel, and they then stay there as, like, the video will stay there on YouTube, and then they become a podcast and social media shareables. And we also work on a pretty detailed PDF, a downloadable PDF, so that people can have essentially like a well-researched guide. So that's what really appeals to me, is trying to kind of broaden out to reach as many people as possible.
So it sounds like, you went a really long time before you got diagnosed. And what I love about the work that you're doing is I think it's really organizing what people have been doing now that Google and the internet has become widely used, right? Which is saying, listen, right now you go into the ether, you read a bunch of stuff, everything inevitably, like, the joke is, like, if you go to Dr. Google, inevitably it's going to tell you have cancer or something. Like, it's like it all comes down to some crazy thing. They're like, oh my God, I must have this horrible diagnosis. But it's hard to know, like, well, I have this vague symptom of fatigue, or I just feel unrefreshed. Like, they can be very nebulous, very difficult to pinpoint things. And so you feel like you don't get any guidance, and you're sort of mishmashing all this. And you guys are really wrapping your head around organizing it, because at the end of the day, you're right. There is a lack of sleep education. It's getting better, but it's still a long ways from where it needs to be. And then I've had so many patients, and I'm sure you actually personally went through this, where they'll tell me, because I'm trained at doing it, can say, oh, this really sounds like there's a sleep disorder, but they're being turned away from their primary care, their GP. And the issue is, as a sleep specialist, lung specialist, those are the people who are sending me the patients. So I can only, unless you go, I'm just going to make an appointment with the sleep specialist, if there's some referral process or what have you, you're sort of left at beholden to however you're getting referred to that specialist for a further workup. So,
which is why I think we need to attack it from both angles. So we need more education of primary care physicians and these GPs that are seeing people in that first instance. It's exactly like you described. Like, I think that's part of why I went undiagnosed for so long. So I went undiagnosed for around 10 years. And when I first started going to the doctor, I had never heard of sleep apnea. Like, I honestly didn't even really think about sleep as being a medical thing, right? So I think of course this was a number of years ago, but the main thing I was showing up to the doctor's office with was anxiety and depression.
Wow.
So one of the things we're going to be talking about in our first Sleep Apnea Squad session is we'll be talking about what all these symptoms are and how differently they can show up in different people. So for me, I think part of what kept me on, I had all of these symptoms, right? I had daytime sleepiness that was so intense that I was, driving while drowsy. I was having a tough time just with any job I had. I was, after lunch, my head would bob and my eyelids were heavy. I had a tough time staying awake. I had intense morning headaches every morning. I, would go to the bathroom multiple times every night. I was clenching and grinding my teeth, waking up gasping. I was snoring even though my husband didn't notice. So all of these things were there, but I didn't know that these were symptoms of sleep apnea or symptoms of anything. I didn't know that those things were worth mentioning to a doctor. You need a combination of patients understanding what these symptoms are and that they go together and that you could have a sleep disorder. It's not a really rare thing. I think I just kind of thought sleep disorder, like who has that? Like, I thought it was a really extreme thing, but it's so common and there's so many people undiagnosed. And I think that the combination between the patient knowing what those symptoms are and doctors understanding a bit more that mood disorders and mental health issues, just asking about sleep, just asking are you feeling refreshed when you wake up after sleeping all night? And so a lot of those different questions that you can ask as a physician help to bridge that gap, I think. So I'm hopeful that if we attack it from both sides and patients get more educated and healthcare providers also learn a bit more about sleep and where to refer people if necessary, we're going to solve the problem.
I love that. And was there any one thing or any sort of symptom that really got you to say, all right, there's something really messed up here. I need to go talk to someone. Like, was there some precipitating event that sort of led to all that?
Yes. So I should probably explain to people watching that aren't familiar with me. So I grew up in Scotland and I met my American husband in Scotland. And then we moved to Florida in 2007. So 17 years ago. I had been going to the doctor, I would say, like at least once a year, gradually kind of realizing it was a sleep problem. Like I think over the years, I started out, they would say it's anxiety and depression. We would treat that. And then I would still be having all these other symptoms. And so we moved here to Florida and I got pregnant with my first child. And I noticed a big difference. I'd been kind of managing my daytime sleepiness and napping and managing to kind of work around it. But when I got pregnant, it was like a real turning point because I was so exhausted. I was so sleepy during the day. Every time I woke up, I felt like I hadn't even been to sleep. I was extremely anxious. I had that gasping for air all the time. Actually, during that pregnancy, I was seeing the OBGYN all the time, it felt like. And they obviously have a lot that they're testing for with the baby. And so I was asking, like, I've been dealing with some sort of sleep thing for years and years, but now it's so bad that I'm really drowsy and sleepy during the day, and what can I do about it? And I was told, like, that's really normal for pregnancy. But at that point, I really started thinking, this is not normal. And so I made an appointment with a primary care physician during that pregnancy, and I went and I said, I know you're going to tell me I'm pregnant, and that's why I'm so tired and sleepy during the day. I really don't think it's just that. I think that there's something wrong with my sleep, and I knew nothing, right? So I'm kind of saying, is there another doctor, like a specialist I could go speak to that knows about sleep? And at that point I was told, I'm not sure if she mentioned sleep apnea by name, but she said, I don't see that you have a lot of risk factors for for going to see a sleep specialist or for testing. I think because oftentimes they're looking at the stop bang criteria, so they're thinking you're a kind of younger woman, and you don't have a thick neck, and a lot of it's kind of skewed more towards men. So she just kind of said, I don't really see enough risk factors for that kind of referral. So I went away, but I really was thinking by that point, there's something not right that we need to address. So I went on and had my baby, and of course it's so funny because after I had my baby, because everybody around me, like in mums groups and going to like library story time with babies, everybody was talking about how exhausted and sleep deprived and sleepy they felt all the time. And it was almost like I found my community because I was able to say, yeah, I'm exhausted and so sleepy and I can hardly keep my eyes open. And everybody else felt like they were in the same boat because of the sleep deprivation of having a newborn. But then over time, as these babies start sleeping through the night, my baby slept through the night probably about 6 months old, like just fine. And so after that, I really noticed, well, the baby's sleeping, but my sleep is not getting better. And so that's when I went back to the same primary care physician and I said, look, I really, really think there's a sleep problem. And I was told, you have a newborn though, so... And I was like, I know, but my baby's sleeping through the night and I am still feeling like I haven't even had any sleep. I'm so exhausted and sleepy. So the thing that was really the turning point, so I got sent away again, and by this stage I really felt like, no, I'm not being listened to, and I felt really frustrated. Um, but also I didn't know enough about the system to know that I wanted a referral to a board certified sleep specialist. So I went away again, and then about 3 weeks after that appointment, I was driving home with my baby in the back seat, strapped into her little cow print car seat, and we were driving across a bridge, the Buckman Bridge here in Jacksonville, where once you're on that bridge, it's really long and there's nowhere to pull over. And so when I got on that bridge, I just had that feeling of my eyelids getting really heavy and feeling like I was going to fall asleep. And I know that most people can relate to that feeling. So you do all the things, you kind of blow air in your face and you're kind of like tapping your face and just trying anything to stay awake. But it was so bad that I was focusing on the truck in front of me and how much space I could put between us, because I knew that it was going to happen. And so fortunately, I had that split second falling asleep and waking up and slammed on my brakes, didn't hit the truck by some miracle. But I had that adrenaline feeling of like I could have died, right? And my baby's in the car, and I think that those kind of things, I'd never really fallen asleep at the wheel before. I'd had drowsy feeling like while I'm driving, but that was the first time I full on fell asleep, and it was the first time I had the baby in the car. And I think that the combination of those just really, almost like the mama bear part of me, like came out.
Right.
And I thought, this is not like, we could have died, right? So I got home, I gave the baby to my husband, and I called back the doctor's office and I said, I just fell asleep at the wheel and I really want to be referred to somebody that knows about sleep. And that's how I got my referral and had a polysomnogram, got my diagnosis with obstructive sleep apnea. And that was, about 17 years ago. 16 years ago.
Wow.
Something like that.
So you spread so many nuggets of truth in just that story. It's mind-blowing. Well, I want to start with, you had mentioned something called the stopping. And for people listening, what I want them to know is that that's literally a screening questionnaire. And it is really geared toward if you're male, do you have a history of hypertension? How heavy are you? What your neck size is? And it's used a lot as a screening tool when we do things like preoperative. So if you have to go for surgery, we basically, surgery can be painful and we want to manage your pain, but we want you to breathe. And if your airway closes off and we give you pain medications, then you're suppressing your drive to breathe and your airway's closing off, and that can potentially be a deadly combination. It's very helpful even in sort of primary care when you're just kind of not really thinking too deeply about sleep, because you're probably going to catch the typical high-risk person, right?
Like, it's so funny because I'm always saying to people, like, no doubt, a lot of those people have sleep apnea. Like, it's not that it's bad, it's just that I think
it's insufficient. It's limited, right?
Especially for women and younger, thinner women who have a different experience. Yeah, I think that it just maybe, if you're only looking at that, it might miss some people, is all I'm saying. It's not that those people don't definitely have sleep apnea. A lot of them will.
No, and what Emma's distinguishing is this is not a rip on a validated questionnaire by any stretch. But what we're really, what she's unpacking here are the limitations of that type of screening test. And I think for me, over the years, what I've really heard folks that are young women, in particular, but even people of different ethnicities, I'll use the Asian population, based on personal experience and also experience of my patients. A lot of times they may be thinner, but there's the one universal thing I've noticed about anybody with sleep apnea that bothers to get to the door, that they're sitting there and they're telling me their story, is that they have symptoms. And I think that's what we really need to wrap our head around as clinicians, regardless of, you're a general practitioner, you're a sleep specialist, you're some other subspecialist. When your patient starts saying there's something not right, and in your case, you had to pee, you had all these other subtle symptoms, you had the mood issues, but for me, it was really the profound sleepiness that would say, it doesn't matter that I'm looking at all these other criteria. Sometimes we get so hung up on what the evidence-based literature says. And in the end, what we come to discover is you take a step back and you go, oh, okay, so the ladies were sort of not included in a lot of this stuff. And so, you start to realize there are gender differences. There are going to be ethnicity-related differences. And we got to think about different people in different ways. But ultimately, we're all human. And if we're suffering, what do we do about that?
And now, a quick break. But don't go anywhere. We'll be right back.
Struggling with sleep? Dr. Cole is here to help. Whether you need a comprehensive sleeping coach program, suspect you have sleep apnea, or simply seek a second opinion, she's available for consultations in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 15-minute consultation today to find out which visit is right for you at AskTheSleepMD.com and start your journey to better sleep with a trusted physician.
If you are liking this podcast, if you're finding it educational, if you are feeling more empowered to go to your doctor with any sleep issues that you might be having to address them, please, please, please lend your support. Make sure that you are liking, following, subscribing. I am available on YouTube. I'm also on Apple, Spotify, or wherever you get your favorite podcasts. The website has launched. So we have AskTheSleepMD.com to be your free educational resource. We've added many new blog posts filled with juicy information. If you would like to support the podcast, we now have a way for you to donate. This is a labor of love. I truly enjoy what I am doing. It would be inspiring and truly helpful if you wouldn't mind even so much as donating $1 to keep this podcast going, particularly if you really find this free education a good platform for you and a good resource for you. I also have affiliate links for products that I'm a proponent of, such as Quiet Mind. So please check out the website, sign up, and you will get the latest news, the latest blogs, some sleep tips, and just have a great day and keep listening. Okay, guys, sleep well.
I was going to say, and also just since I've been working with Project Sleep, I realize there are so many different sleep disorders. I think sometimes we get very focused on sleep apnea because it's so common.
Right.
And it's so commonly misdiagnosed or undiagnosed. But if you're having excessive daytime sleepiness that's really interfering with your job or your driving or taking care of kids, whatever it may be, like that really deserves somebody looking at it, right? So, even if it's not a sleep apnea thing, it could be any number of other sleep disorders. I just think that a lot of people are being turned away when they know that there's something wrong with their sleep,
And I love that you're sharing that because at the end of the day, let's look at the risk-benefit ratio of actually doing a sleep study. Did I draw blood? Did I give you radioactive material? Do you need to get a CAT scan or something? Yeah. Do I actually have to give you anesthesia and do some sort of, scope or something that may be invasive? The answer is no to any of it. So when you think about it, it's like, what's the investment in time? And then there's different types of sleep testing. And I've alluded to it on various episodes, but you mentioned the polysomnogram. So that word is basically what we use when we describe you're coming into the sleep lab. And Emma, that's profound for you because as a sleep physician, we're often beholden to what the pre-test probability is of someone having sleep disorders, comfort level of the patient, and what's approved by insurance, right? So right now it's a standard we call type 3 home sleep test. If I can concoct all sorts of different stories that would get my patient approved for that. It's just about how deeply I probe. But there are some limitations, just like there's limitations to some of the screening tools that we use, like the stop bang. There's limitations to home sleep testing. And I love that you're pointing that out because what can happen, especially for women who may not be the highest probability, and again, some of the Asian patients that I've seen, it seems like everything's normal. And so it's like, oh, you snore a little bit, but I don't really see anything on the home sleep test, but you may be missing it. So doing that, not just saying we're one and done.
Sometimes also where patients advocating for themselves comes in because, the number of people I've talked to where they've had a home. I think people should think about home sleep apnea testing as kind of like the first stage, right? So for a lot of people, that's going to pick up sleep apnea beautifully, and
Right.
that's great. For some people, especially anecdotally, what I hear from a lot of women with lower AHIs, so they maybe don't have as many events and they're maybe not as, extreme, but they're still having this really disrupted sleep that's really affecting them on their daily life. So my thing is, oftentimes what happens is they'll have a home test which is negative, and they say, well, you don't meet the criteria for sleep apnea. Well, the thing there is, like, let's then ask questions as why they have the symptoms that they came to you with in the first place, right? So I think sometimes that's a bit of a back and forth with your provider to say, maybe now it's time to do an in-lab polysomnogram to see what's happening. Just from hearing people's stories for years, there's a lot of people where, the home sleep test will show that they don't have sleep apnea, but that person absolutely does have a combination of milder, like less than 5 AHI sleep apnea, which everybody would think is not worth bothering about. But for some people, their body will react to those arousals quite in an extreme way, or they can have restless leg syndrome, or
Right.
Other things that are not being picked up. So I think sometimes it's about doing more testing.
Yes, and the testing, other than, honestly, depending on your type of insurance, may hurt your pocketbook a bit.
Yeah.
But other than that, it's really safe. You're not doing anything. If anything, you're gathering information.
Right.
So it's very benign to do the
not
testing,
invasive.
other than an investment in your time to figure out how the heck you feel better, right? Which impacts every aspect of your
Yes.
life. It's so key. And the other thing that is really, really interesting is just your journey through pregnancy, because that's the time that we know that if you have untreated sleep apnea, there's more and more literature coming out. Basically, at the time, it was not unusual for an OBGYN to tell you that. But now we're having more folks that really take care of these pregnant patients that are saying, wait a minute, we're actually seeing poorer outcomes in those people that are left untreated.
Yeah.
Did you have any issues with what we call preeclampsia or high blood pressure, anything that, was concerning?
Yeah, so I didn't, thankfully, and I mean it's really, it's amazing to think about now, because that baby that I was pregnant with is now a strapping, almost 17-year-old volleyball player who's taller than me and is doing great. So yeah, I was really fortunate in that way. But I know from my experience, having one pregnancy with untreated, undiagnosed sleep apnea, and then having another pregnancy with my other daughter where I was on CPAP and, getting the oxygen I needed and all that, I felt completely different.
Whoa.
So, yeah, my pregnancy the first time, I really was, not bedridden, but I pretty much was like napping multiple times a day to make it through the day. And the second pregnancy, I noticed a really big improvement in that. So yeah, if you just think about it from the oxygen point of view, that you're growing this other human.
And they need proper oxygen. It's
yeah.
really, really important for the development.
So I do think things are getting better, and they are doing a lot more research in that area, which I'm really thankful for. But I still think there's just too many women not maybe looking out for it, and I'm sure things are improving and getting better, but yeah, it's just something that we really need to be aware of. There's pregnancy and there's also menopause, which is a whole
other can of worms. Oh my goodness, yes. And that's where the risk factor for women tends to go up, because there's something protective about our hormones when we're fertile, if you will, during those earlier years, premenopausal, and things change, unfortunately. Yeah. And then again, it's the poo-pooed concept of, well, you're just having hot flashes and what have you. And it's funny that we're talking about this, because I'm actually preparing a grant for what I do for continuing medical education, really trying to think through how do we reach and adjust people's the perception of clinicians to capture folks. So this is the most appropriate conversation because I'm like deep in the weeds of beginning the research process and trying to get together that grant literature. I'm so tickled that we got a chance to talk. So you're describing CPAP as being, I guess, primarily your modality for being treated. Did you go through any permutations in terms of treatment? Meaning, did you initially, I mean, I've had people where I'm like, okay, I see sleep apnea, and then it's like they've made that leap. We've secured the diagnosis now. Yeah. And then they're like, wait a minute. Am I really that bad? Do I really need to be treated? And I almost have to convince them of the treatment. Yeah. And even when I talk about multiple types of treatment, they're still like sort of hesitant to think about CPAP. Yeah. What was your journey like?
From talking to all these different people with sleep apnea over the last few years, like that comes up all the time. You have people who don't even want to go through testing because they already, have decided that they don't want to they perceive that CPAP's the only option, and they decide that they don't want to do it without having tried it and all that. So I think what I would say about that is when I first got my diagnosis, I was so desperate to improve the quality of my life and get rid of the drowsy driving and those kind of things, that I would have done anything. I mean, they basically said, like, you have obstructive sleep apnea, which I had never heard of. They said the treatment for that is CPAP and you'll feel much better, is what they told me. And they gave me the CPAP in a plastic bag with a mask that didn't fit and sent me away.
So classic. Okay.
So I definitely had a number of months to begin with where, I struggled to find a mask that fit my face well. I struggled with, like leaks and figuring out all these things. And there was a lot of, troubleshooting on back in the day. And this was like 2008. I was on, CPAP forums, which, is not really my comfort zone, but like it seemed like a lot of these people actually had been through the same thing. So I was able to kind of troubleshoot my problems and come out the other side. And so I would say like by probably like the third month or so, I was sleeping every night with the machine. I think it's really great for people to know that sometimes there is more of a learning curve at the beginning. I come across people who put on their CPAP the first night, feel better, think it's amazing and good for them. But I think that, just knowing that there's a bit of a learning curve can help people, to set out thinking, okay, I'm going to have to get used to it. It's going to be a process. So I use CPAP the whole time. And then for me, part of why I started the podcast was just that, I'd been going to my sleep specialist for years, once a year, and him saying, looks great. And I never really knew that there were other treatment options. And so the way that it came out for me was I was in a doctor's office right like before the pandemic happened. And I saw I had a big wait. So I was like reading one of these like magazines and it had a story about sleep apnea in it. So a whole bunch of it was about how CPAP works. But then the last like little paragraph was about if CPAP doesn't work for some patients, for them there's the Inspire implant, there's the oral appliances made by a specialist dentist, there's surgeries like, with ENTs and different things. And I just kind of thought to myself, like, I've never heard of any of these things. My doctor's never mentioned anything. I wonder, I just kind of got curious, right, about like what other information was out there. So I just listened to podcasts all the time. And so I was trying to find a podcast that had, really what I was looking for was people sharing their own experiences of using those different treatment options. So that's really where my podcast came from, was just like that curiosity of like, what else is there? So it was really through the podcast that so now I'm still using my CPAP, but I have added an oral appliance at the same time. So that really came from a woman that I interviewed on the podcast who also has severe sleep apnea, and she was sharing she found her CPAP pressure to be too high at one point, and so with adding the oral appliance, they were able to titrate her CPAP pressure down because she was wearing the oral appliance at the same time, and that had worked really well for her. It doesn't work for everybody, but I thought, well, maybe I could try that. And so sure enough, exactly what you were saying about insurance and jumping through hoops and a lot of out-of-pocket expense and everything. But it's been worth it because I went into perimenopause and gained some weight, and my sleep apnea got a bit more severe. My doctor, my sleep specialist, had raised the pressure on my CPAP, and I just was finding it not as comfortable as before. And now that I have the oral appliance, we've put the pressure back down to kind of where it was, and like it's much more comfortable. So I think that sometimes people don't think beyond, like, they don't think about combining therapies together. They don't think about, there's positional therapy that nobody thinks about, where some people really all they need is, like, you can ask your doctor, like, how much did I have events on my back versus my side? And for some people, sleeping on their side in an elevated position is all they need. So I think that there's lots of these options that we're not really thinking through. And of course there's restraints on doctors and what they can do in 10 minutes, which I totally get that. But that was kind of why I saw that there was this need for my podcast and asking those questions of people.
Oh my goodness, there's you were just a plethora of really useful information, and I love that. And I think also too, this is, again, we'll go back to your 6-week CPAP Solutions Workbook. There's a lot of stuff in there because most people, if you think about it, right, you have like a rule of thirds-ish. You have a third of people that are like off to the races, everything's hunky-dory. You have a third of patients that really need to work to find where their kind of footing is with CPAP. And then you have folks where it's simply not going to be an option. Yep. So just throwing in the towel for them, what are some other solutions? And I love the fact that you brought up that you can do more than one thing. Right. The other thing I wanted to add to what you're saying, because I'm hearing you also mention, I'm going to see my doctor routinely. It is very typical if a patient's doing well that as a sleep physician, I probably see you on a yearly basis. Yeah. That being said, some people have comfort with seeing me more frequently, and I'm like, heck yeah, you want to talk to me? I'm going to be your support system here. Yeah. Come see me. The other thing that I've had that I think is worth mentioning here when people are kind of thinking outside the box about, like, well, I got my CPAP, I'm fine. Like, I'll just hit you up in 5 years, peace out, when I get my new machine, is that sometimes things change. And I've actually had this with a few patients where, on their usual yearly schedule, everything looks hunky-dory. And then they're like, I'm not feeling refreshed again. Like, what's up? And sometimes what we find is that CPAP that worked for them for so many years, sometimes other things, and we don't even always have an explanation for it, but sometimes other things creep up. Yep. Like I had a patient with long-standing history of cardiac arrhythmia that we call atrial fibrillation. Yep. It's very, some people sort of live in it, and it's very manageable if you keep the heart rate controlled, and they'll be on a blood thinner for that. Yep. But what can happen is, even if your heart seems to be otherwise pumping okay and everything looks okay, that person started developing central sleep apnea on top of their obstructive sleep apnea. So we ended up kind of changing the type of machine that they used, but that came with regular follow-up, like that regular dialogue, that consistent relationship. Yeah. So I think sometimes people are like, hey, I'm done. I don't really need to see anyone. And I think continuing that relationship, because I want to know how you're doing. Yeah. And, yes, our machines give us data, right? And it'll give us feedback, but doctors don't automatically get that often. Sometimes we may get like a yearly download, but if you think about the volume of people a lot of people are seeing in regular clinical practice, it's just a lot of stuff. And if somebody doesn't flag it, So
that's really, really interesting, because I think sometimes, especially people I've talked to, in CPAP manufacturers and DME companies and different people, the technology is there for sleep specialists to be able to see everybody's data all the time, right? But it's, in that's my experience as well. Like with my sleep specialist, like they would kind of do this download just because they were meeting with me that day, and so, which is fine, but it's just, I think sometimes we think that because it's possible because of technology that sleep doctors have all this time to be checking every single person's data all the time, which they really don't. So yeah, it's exactly what you said about checking in with how patients are feeling. Like, I think the symptoms are really important. Certainly for me, when I've had, and it does change over time. So for me, I've been on CPAP for 16 years now, and it's probably 3 or 4 times in that span that we've had to increase the pressure, just to kind of make sure we're keeping up with where my sleep apnea is. So it's kind of important. The other thing I come across all the time is people who, like you were saying, don't go for that annual checkup. They don't have anybody checking, like, when did you last replace your CPAP? Because CPAPs are supposed to be replaced every 5 years, right?
Great point.
I come across people who are like, well, I had my test, 8 years ago, and they haven't seen anyone since. And I'm like, it's going to be time to get a new CPAP at the minimum, let alone how much it might have changed in that time. So I think it's important to try and stay connected. I mean, I say that, but with the way insurance is, I've changed sleep specialists so many times, just with my husband being self-employed, and we've just, every time we change insurance, I feel like that doctor's not covered, now we're on to the next one. So it can be kind of disjointed, but it's important, to stay.
That's a great point too, because number one, don't let your machine tell you that basically you've overused your hours. I've had patients come to see me because they're like, my machine basically says it's reached the end of its lifespan. I'm like, the machine from 10 years ago. I'm like, oh my goodness.
Yeah.
But, the next thing too is that when you have to, unfortunately, the way our system is set up, which is very imperfect. That's an entire series of podcasts, to deal with that whole issue. One of the things that I think I encourage folks to do is, as you're becoming your own advocate, and that's what Emma's teaching you how to do, keep records of that. I always try to tell my patients, I'm like, listen, you never know what the future holds. Yeah. So have those records. Here's a copy of your sleep testing. Here's a copy of your compliance. These are your notes. Like, I really try to be very transparent with folks that they have that information, so that you can scoop it up and take it if if unfortunately you need to switch providers, which a lot of my patients, needed to do when I made this transition. So, man, you're making me really, really miss all those patients I used to see so frequently. It's just, these are tools that are going to be really helpful for you moving forward to have that information. And believe me, I don't know about you, and you've probably been much better than me. I feel like as a physician, I'm my own worst patient, because I'm like, okay, when did that happen again? What side did that happen on?
I was going to say, don't be implying that I have everything figured out. Like, I have a little folder with some data from sleep tests kind of shoved in, but it's not organized or anything. So as we wrap up, what I can say is Emma has, I think in the span of 42 minutes, taught you guys so much about what you can do just from sharing her story. And that is why I love doing this, because I feel like, and I'm sure that's why you're as deeply involved, because it's so rewarding to know that you're kind of giving back and trying to make the world a better place with what we're doing. So Emma, I am just so excited to see what the future holds on your journey forward. Keep it up. Keep up your compliance with that CPAP and oral appliance. And thank you. Really. Well, thanks so much for having me. I appreciate it. Can I just give a shout out to, if anybody wants more information about the Sleep Apnea Squad, my new program, you can go to project-sleep.com. And if you click Get Involved, there's a tab that says Sleep Apnea Squad. And if you really want to join the squad, you can sign up for e-updates.
Yes, and any links that Emma wants me to share with you, all of that's going to be listed in the podcast as it comes out.
Thank you so much.
Like in the episode. So no worries, it'll be on social. I'll be tagging you.
Perfect.
Please, let's spread the word and make sleep better for everybody, especially for the 50 plus million Americans that are suffering from obstructive sleep apnea. Thank you so much.
Thank you so much for having me.
Disclaimer. The statements made on this podcast have not been evaluated by the U.S. Food or Drug Administration. They are not intended to diagnose, treat, cure, or prevent disease. The information provided by this podcast should not be used as individual medical advice. While I am a practicing sleep provider, I am not your sleep provider. You should always consult with your personal healthcare provider for individual recommendations and treatment.